welcome to Health Live at Seniors Today. We are on May 31st when we are live, and today, as it happens, is World Tobacco Day. And we thought it would be appropriate to have a session dedicated to tobacco and the entire problems that it creates. So dealing with tobacco addiction, and we added the bit that it is active and passive tobacco addiction, and that's what we've requested Dr. Vinod Chavhan to. We've invited him today to take a session. So, yeah. So, welcome to Health Live at Seniors Today. We have, as I mentioned, today is World Tobacco Day, and today we have a session which is on dealing with the tobacco addiction. And for this, we've invited Dr. Vinod Chavhan, who is a consultant chest physician and a pulmonologist at the Kokilaben Dhirubhai Ambani Hospital in Navi Mumbai. Let me, before I invite him to speak and make a presentation and then take questions, Dr. Chauhan has been working with the Dhirubhai Ambani Hospital, Kokilaben Dhirubhai Ambani Hospital, and he is a respiratory physician there. And he earned his MBBS from the MGM Medical College in Navi Mumbai and holds a fellowship in the College of Chest Physicians from the US. Additionally, he completed a diploma in chest medicine from the Nanavati Max Hospital in Mumbai. He has performed over 500 flexible bronchoscopies, showcasing his expertise and dedication to patient care. He is experienced in various areas, including bronchoscopy, lung biopsy, interstitial lung diseases, ILD, and asthma. His knowledge and proficiency in these areas ensure that his patients get the best care. And today, as I mentioned, he's going to be speaking about tobacco addiction and how we can combat it and how we can be better equipped with it. Over to you, Dr. Chauhan. How have you been?
Thank you very much for inviting me and giving me opportunity to explain the tobacco. No tobacco day. Tobacco is the biggest problem in the not only our country but all over the world. There are various forms causing it, and we have to keep awareness to each and every age group of the people, not only the adult or teenager. We have to educate from the school going children to adults. So anyone are welcome to join the team. So in here is the adult, but it's all our duty to educate all these things to the teenager and younger children in our society. We can means small whenever the children are playing in our society, you have to talk with them and you have to educate with them. So we'll first go through the small presentation. Is it visible?
No, it's not visible right now. You'll have to share it.
Yes, sir, just a minute.
So as Dr. Chauhan gets his presentation ready, do note that the presentation this entire session is being recorded, and it will be up on the Seniors Today website on Monday evening. So you can have a look at that. And please post your questions immediately after his presentation is over. Yeah, Doctor, I'm not able to see it.
Yes, sir. Okay, now it's visible?
Yeah, it is visible. It's not full screen yet.
Yeah, just a minute. Now?
Yes, now it is full screen. Thank you. Over to you, Doctor.
So I'm working at Kokilaben Dhirubhai Ambani Hospital, Navi Mumbai units. We all know we have a 3 unit, one in Mumbai, one in the Indore. So tobacco farms. Now, whenever there is a tobacco thinks only the cigarettes and the smoking form of tobacco. So tobacco farms are available like a smoked tobacco in cigarette, cigar, bidi, hookah. So these are the various form of the smoked tobacco available in our country, all over the world. Like cigarette easily available, cigarette very little restriction, bidis more common and popular in the rural part of the country. Like cigarette is more common in the urban part of the country. Hookahs are the very different places. You will get the hookahs. there are smokeless tobacco also. Like there is no formation of the smoke, and this like a chewing tobacco, snub, gutka, pan masala, and tobacco. So these are the very different form. They are easily available in the small sachet all over the country in small shops like Pandrapri and all those things. So these are the farm available everywhere. Then emerging products now in the name of e-cigarette and vapors, like they are also available. Heated tobacco products, STPs are also available. These are the various form of the tobacco available, and different forms causing the different issues. Means more or less they are causing the damage to the our body only, but they are specifically affecting the different organ. Like smoke, tobacco, cigarette, cigar, bidi, hookah are prominently affecting the lung capacity firstly, and then they are going to the systemic diseases. Smokeless tobacco, they are consuming via the oral cavity, so oral form of pathology like oral cancer and all those things are happening. Initially, they start with the oral hygiene and slowly progress to the malignant diseases. E-cigarette is the same. People think e-cigarette are the better and they are not causing the problems to the human body, but yes, they are also the problematic and they are the part of the same smoke tobaccos. So smoking is the most common and most aware problem throughout the world. So tobacco is the leading cause of the preventable disease and death. So there are some disease which can prevent and which can't prevent. So tobacco is a preventable disease, and that means tobacco is a causative factor that we can prevent to consume, we can refuse, we can keep aware the society, people, community, and prevent them to leading to the particular disease like cardiac disease, lung diseases like malignancies, cancerous, and all those things. So it's a preventable cause. So we if we avoid the tobacco, then we can prevent the many diseases. So over 8 million people die yearly due to tobacco use. So it's a quite huge number. They are dying not only directly tobacco, but they are dying with the other cardiovascular disease, cardiac disease, brain hemorrhage, malignancy, cancer, lung diseases. So tobacco is contributing to each the death and his disease as a major organ of the body. Smoking is a global endemic, especially in the low and middle income countries. So smoking, there is, we can say it's a ubiquitous, like it's like a air. Wherever the air pairs, then there is a human beings are there, and the smoking is common. Every part of the country, not related to any socio-economical social status, but it is common. The form of the tobacco use is different societies. Initiation of often occurs in the adolescence and early adulthood. So it's common in the early age of the early age when the people are young, they get exposed to them because of the some reason, and they start in their age group, and that not going to cause the immediate effect, but yes, in later part of their life they'll get they notice the problem of the smoking. Smoking in general is a big health issue that can be prevented, that can reduce by the awareness only. Yes, there is no banning on the product, but yes, you have to keep aware of the awareness, the explanation, education to the society, children. Rather educating the adult, we have to start educating the people in the school education they have to be included in the study material from the school only. So there are two types of smoking. The person who smoke is called as active smoking, direct inhalation by the smoker who smoke directly, and the passive smoking is the person who is not smoking but is around. So like one person, some A is smoking and the person around him is not smoking, but he's getting inhalation of the smoke material and particle. That's called as passive smoking. Or it sometimes it's called as second hand smoke. So most of the time, husband are smoking and wives or children are getting exposed, they are the passive smoker. So in active smoking, direct inhalation by the smoker. In the passive smoking, inhaled by the non-smoker around the active smoker. So contain over 7,000 chemical and hurdles are toxic, causes disease in the children and adults like asthma, heart disease. So passive smoker means whenever you are taking history, we used to ask the patient, are you smoker? No. Is anybody around you smoking? They say, yes, my husband, my friend are smoking. So sometimes the passive smoker so much exposed and they develop the disease faster than the active smokers. So smoking related health issue, like means we are targeting only smoking, but smoking is a tobacco form only. So what are the health issues happen with the smoking? Like it's in the lung, which is the breathing organ of the our body, that can lung cancer, chronic obstructive pulmonary disease, and asthma can happen with because of the smoking. Heart attack, stroke, paralysis can happen because of the smoking, because they cause the narrowing of the blood vessel in the heart and brain, and that cause the heart attack and the strokes. Other cancer like mouth cancer, oral cancer, throat cancer, and other part of the body. Every cancer, every major disease of the body, if you see the risk factor, the smoking is common everywhere. And the like a lifestyle and the smoking are the common things in each and every disease of our body. Reproductive, yes, infertility can happen because of the smoking, and that can lead to complication during the pregnancy and childbirth. Children, when some mother are smoking, the children are getting low birth weight at the birth time, and the sudden infant death can also happen because of the if the mother are smoking. So these are the smoking related complications that can affect like lung, heart, brain, reproductive age group, children with some congenital disease and all those things can also happen with the smoking. So the what is the solution behind it all? The many people are smoking, and what is the solution? So smoking cessation is the program. So first thing we have to the awareness program. Like today is a no tobacco day, and we are doing the awareness about the smoking related problem and how to prevent it, and they are causing some problems. So smoking cessation also benefit of quitting the smoking. Heart rate can drop by quitting the smoking. 2 weeks, 3 months, lung function improves, and at 1 year, risk of heart diseases going to the reduced by the half. So these are the smoking. So heart rate gets under control, lung function gets improved. At the 1 year, your heart risk to the heart diseases goes by half. So what are the method? Everyone asks, yes, we are saying the benefit, then what are the benefit of stopping the smoking? And those are the methods also. How to stop? So they, because smoking is the not problem. Once over the period of time exposing smokes and smoke, they get addicted. So what is the substance which cause their desire to smoke and use the tobacco? That is the nicotine, the content in the tobacco. So while stopping the smoking, while quitting the smoking, you have to replace the nicotine, because they are so dependent on the nicotine. So we have to use the nicotine. We can't stop directly. We have to give the nicotine replacement therapy that is available in the patches, chewing gum, and multiple formats as available in the market. So nicotine replacement therapy is the easiest therapy available to quit the smoke. There are medication like bupropion, valence cleaning. These are medication available. Then we have to give this medication under the observation of the clinician. Behavioral therapy and support group. So most important thing in the smoking cessation is willing power. We have to first the person who smoke has to willpower to make, yes, I can stop it, and then the behavior of the person can change, and then the support group. If somebody is stopping, and then somebody around the him in a daily either work environment and in a family member have to encourage, yes dear, you finished 2 days, yes dear, you are finished 4 days, every day, yes, you are going in a such a way the days goes increase, and the patient feels confidence, and yes, he feels yes, somebody is noticing. If somebody is doing the bodybuilding activity and he's developing the bodybuilding and nobody is noticing it, then he say, "Arey, what is the use of it? Then it's not necessary to do it." Yes, then he get discouraged and he'll stop the exercising and all those things, or he will do the some minimum exercise. So if you are getting something reward, something's good word for doing some act, yes, definitely that will go. So behavioral therapy, the social support or support from your family member, friends, workplace, that definitely help to stop the smoke. There are now, it's a technology is there everywhere. So there are mobile and quit lines. They daily encourage the reminder, and they are giving some the positive thoughtful messages and the reminder. They are multiple app, they're guiding in a same way, because that is not going to replace the behavioral therapy and support. So they, if the people are living in a remote places, they are alone, they want to quit, so they have to take the benefit of the technologies. So this small presentation for the general population, it's a simple to understand. So basic, what is the smoking in general? What are the various forms available in the tobacco? Then there are two type, active and passive smoking, and the how, what are the smoking related health issues, and how to stop all those things. How to, this is not only smoking, but we have to stop the use of the tobacco, other form also. And this how the help the society and help the people to keep their, rather than lung, yes, because yes, smoking is directly related to the chest patient, but yes, it is not going to help only for the lungs, yes, but all over the body, all other organ are getting benefit from the rather than the smoking situation. We can say stop tobacco. If you stop tobacco, your all the organ gets benefit, and ultimately your body gets the benefit from it. So
Thank you, doctor. Thank you very much uh, for your very detailed presentation. Doctor, you've seen, you've been following as the situation in this country. Do you think the problems have increased over the last few years?
Yes, sir. That this the problem we are facing are day by day increasing. The problem not only in this, that is definitely increasing with the stress level, the availability of the different forms, and all those things. Yes, definitely they are increasing day by day.
Um, one of the things when we were when we were talking about this session, and you were wondering whether we should also have um, a psychiatrist, in this session along with you, and this is a question that is there concerning that. This is from Kiran Kapadia. Uh, uh, she asks, "My husband is 80 years old. He has been consuming a gutka, I'll not name the brand, for the past 30 years. How should I help him quit?"
So if he is consuming since long and his old age, yes, he has to consult the goods. Rather than the psychiatrist, he has to meet the psychologist first, and then if required, if he needs some replacement therapy, then he needs to meet the psychiatrist.
Right. And are there any psychiatrists who are trained to handle the addictions?
Yes, sir. The most of the psychiatrists nowadays, because their branch is also emerging, they're handling those smoking cessation, like alcohol cessation and all those things. But they, on first setting, they do the counseling, psychological counseling to the patient, and if required, they initially they does the counseling and non-pharmacological without medicine, and if patient respond, they don't use the medicine, and if they not responding, then they start the medicine to suppress it.
Right. We have a few more questions that has come in. One is from Shamla Ravi, who asks, "How effective is cold turkey?"
Cold,
Cold turkey.
cold turkey.
Hmm.
I'm not in cold turkey, sir.
Right. Okay, no problem. We'll let us look at another question that is there. This is from Radha, who asks, Doctor, if a person has been smoking for the last 30, 40 years and suddenly he stops, will it have an adverse health problem?
Yes, sir. If you are using since long, your body is dependent on the nicotine, as I mentioned. So your body is dependent on the some kind of that ingredient. So in that, you while stopping, you have to switch to the replacement therapy that is causing less effect on your body. Its body is not required the smoke or the tobacco form. Body is required that contain nicotine. So you have to replace with the nicotine therapy. Otherwise, your body get the withdrawal symptoms, and that withdrawal symptom can be up to the suicidal level also. So
Right.
if somebody is smoking too long now, he has to consult the proper person and then slowly start rather than stopping suddenly.
Yeah. So, which is what actually cold turkey means, just stopping it suddenly. And I know you have given the answer for that. Um, uh, Dr. Sunita Verma asks, people say that BD and hookah are safer than cigarettes or even cigars. Is that true?
No, sir. That all the farms are nothing is safer. Everything is causing. There's the promotion propaganda. So everything is causing. Some say my cigarettes are this, some say this, but all farms are going to create the problem only. Nothing is safe.
Right.
Everyone says my things are better, yes, but ultimately direct smoking, like yes, BDs and all those things, direct, there is no filter. There are the some higher variety, they have filter. Some people say the e-cigarette are safer, but nothing is safer. Everything is causing problem.
There's a question from Sunita Verma. In fact, there are two questions. One is from Sunita Verma as to how can one decrease the effect of passive smoking? The other is uh, uh, someone who's SMS saying that my neighbor smokes and he's just in the floor below. And I inhale the passive smoke whenever I'm there near my window or I'm in the balcony. What can I do?
It's a social responsibility everyone to take care of your other people also. So first thing that the other person has to, if he is smoking, he has to stop smoking for his health. Somebody has to go to him and meet, and then he has to explain them, you're smoking not causing problem to your health only, so but you are causing simultaneously problem to your neighbor and your society also. So somebody from the nearby close friend group has to sit with him and talk with him for the reduction or stopping the smoking. And some people, yes, some people may not listen. Then we have to guide them, and we have to guide them for. Some people want to stop, but they don't know the where to go and how to stop. Then somebody has to give the guidance. Even though if it's not stopping, then it's. As we can't smoke in the public places, so here then we have to take the on other way, we have to close the windows and we have to take the precautions. If somebody is smoking in front of us and he is not stopping, then we have to move from that place and we have to take care of ourselves. Self care means first is to aware those people and ask them, convince them. If they are not going, because they are the smokers since long, they can't stop immediately. So we have to take care of ourselves by just closing the windows, and we can make a talk with our societies and all those things. So it's a person to person discussion, sir.
Right. We have a question from Suresh Agarwal who asks, Doctor, I have a sugar and liver problem. I smoke about 7 to 8 cigarettes in a month in parties only. Is that harmful?
Sir, uh, in a practical way, uh, everything is harmful. Like if he is a liver and diabetes, yes, already he is having the two diseases and he's smoking. Yes, definitely, yes, that is harmful. I can't say it's you can enjoy once in a while, but yes, definitely these are harmful.
Right. There's Kashi Vishwanathan from Bengaluru who says to avoid passive smoking, the Bangalore municipality has increased the penalty from rupees 200 to rupees 1000, which I think is a very good sign, except that I hope it is being administered and being levied properly, because it's so difficult to check on that.
Sir, it's a bad thing ki because of the penalty, somebody is stopping the smoking. So people has to aware that rather than because of the penalty. In our country, people wearing the helmet to avoid the penalty, not for their head injuries. So it's like that. So the penalty, if somebody is going to smoke, he is going to smoke at any cost. He will search the places. But increasing the penalty, all those things are not the solution for that, sir.
Doctor, I live in Pune, and it is one city where there are so many two-wheelers, and the majority of the people are not wearing helmets. And unfortunately, despite the fact that it's known that it is harmful, it could be harmful, and it could be leading to the death. It could be fatal. But despite that, people are not wearing helmets. So it's unfortunate. And despite the fact that people know that it is smoking is injurious, um, uh, people continue to smoke. Um, uh,
Even the packets are mentioning that smoking is injurious to your health. Sir, when we are doing all this education awareness, and once you go to the airport now, you will find somewhere smoking zone. There is a shop that's selling the cigarette, and there is a smoking zone. So, on one hand, government is giving the penalty; on other, you are providing the places to smoke also. That are very difficult to handle. So means there are multiple things there are not in our control. Our in what in our hand, we have to educate the people, keep awareness, give guidance. If many people are the I think senior citizens, so if you are sitting in your society in a garden, some people are playing, just chat with them what they are doing, just understand their mind and all those things. Is there anybody smoking or something, then in the small chat in a garden or in a society, if you are sitting, just talk with the children, think about them and what they think, go to their behavior, and then that brings the big things rather than just giving penalty. I don't think so that will help, but senior citizen can help to the guide to the adult young children and school going children. So many time I done such talk on the schools and colleges, so that gets impact. So our goal is not to keep aware the 100%. Yes, if we achieve in this meeting, I think how many people joined here? More than
we have 202 people.
means 200 people, 202 people. So if 4 5 people stop now, we achieved our goal.
Oh, absolutely. I think clearly that is what it is, and I think the fact that so many people are there, and there are a fair number of people who are watching us on YouTube as well. So it clearly means that they are interested in the subject. And but the point is, as Shobha ji has said, what if somebody is living in the same house? How do we avoid passive smoking? So would you recommend that in case of situations like these? uh, just as one goes to a marriage counselor, you should perhaps go to a counselor, and where the husband and wife, or the parent and the child, or or some such, they go to a counselor and speak to them. Is that what is recommended?
Yes, sir. First attempt to go to the quitting smoking is, yes, you need a good counselor, psychologist who will going to help you to stop all those things. That person knows the benefit means different from of the smoking available, what are the complications now and what are the late complications. Yes, definitely. Counselor means medical background counselor, or we call it a psychologist rather than the psychiatrist. If you ask the people to go to the psychiatrist, they will not go. But yes, there is a psychologist. There are some people who like a counselor. They counsel the people if they are doing in a home. First attempt and goal is to train them just not smoke inside home, at least smoke outside home, and don't expose the other people, because the lungs of the children are weaker than the adults, so he has to smoke. First goal is to quit smoking. If someone is not listening, then you have to ask them, just go out of your home and then smoke, and slowly, and we have to create the emotional things for for the such people. And
Right.
how can they will say ki, they to their children don't smoke? They again smoke. Na? So the behavior goes from, in our country, it's our natural process. Behavior comes from the adult one to the children's.
Right. Uh, Thank you very much, Doctor, for this presentation on tobacco, and I really hope that you know, after listening to this session, people are taking note of it, and they do something about it. Uh, Doctor, since you are here, and you are a chest specialist, I couldn't not ask you about the COVID situation as it stands today. How is it now? We of
So
course we spoke last week also to the doctor who was there, who and but it is developing. So has it really, is it really something which is to worry?
sir, at present, there is nothing to worry about the COVID situation. So we are living since long, we are seeing since long, every season, whenever the weather changes, there are the lots of flu cases goes around us. Now, because we have the technology to test all those things. So that's why we are coming to know it's a COVID, because the COVID happened still in our memories. So that's why we are finding cases, but they are just milder cases, nothing to get worried, nothing to get panicked. It's behaving like a normal flu. Yes, like every flu, you have to take care. If you are sick, if you are having throat infection, you are having antiviral, stick to your home. Don't spread to anyone. Take proper food, oral good amount of liquid, basic medicine with the guidance of your physician. Keep yourself little bit away from the people and don't spread it. But nothing to worry at present at all regarding the COVID.
uh, Doctor, I was in a train from Mumbai, from Pune to Mumbai, just yesterday, and there was somebody sneezing next to me. Is that something I should be worried about? And I must confess, I wasn't masked up, although I did conduct a session last week where the doctor had said that you must mask up, but I wasn't wearing a mask. Is that something that I should be worried about?
So as I mentioned, so wearing mask by everyone is not a good idea. If somebody is sneezing and coughing, then he have to use the handkerchiefs to just like a social hygiene. This has to follow everyone. And if somebody is sick, as I mentioned, he has to stick to the home. If by somehow he has to travel, he have to work, then he have to take precaution. But he has to use the mask rather than the everyone. And if there is no mask available at that time, he can use the basic handkerchief, basic some protection, not to spread to everyone. And every sneezing is not a no COVID. Every cough is not a no COVID. Sneezing can happen because of the dust also. There are other allergic component also that can create the sneezing, coughing. So every smoking, every coughing, sneezing are not the COVID. Still, the person who is having the those such problem has to take prevention and precaution to not to transfer to the other one.
I think very, very well said that every cough and every sneeze is not an indicator of COVID. And I think on that note, Dr. Vinod Chavhan, thank you very much for being here. This is World No Tobacco Day on May 31st that we are observing. And your words today should be, should be spread very well, because I think that's the need of the hour. Thank you very much to you, Doctor. Thank you to the team at the Kokilaben Dhirubhai Ambani Hospital for facilitating this. Thank you.
Thank you very much, sir. So hope so. At least if we get, as I mentioned, at least five people stop,
Absolutely.
that is our win-win situation. We have to see the small benefit.
Absolutely. And I think, can I just do a small exercise? Since there are over 200 people here, to all of you over here, will you send the message to at least two people around you about smokers? Raise your hand. There's a sign um, on the uh, Zoom platform where you can raise your hand. So please raise your hand about whether you will actually go out and motivate people to stop smoking. Yeah, so we have a fair number of people who have raising their hand. Fantastic. I think
And
that's the spirit. You, doctor, you've
yes,
started that. Motivated people to do that. So on that note, on that very happy note, thank you, Dr. Vinod Chavhan. We will be back again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Do remember, we have the Evergreen Club, where you have programs in the morning, afternoon, and evening. We have the Seniors Have Talent. Season 18 has started, which is on Wednesday evenings at 5 p.m. There's the website that we update every day. You know that. And the newsletter comes out at 6 a.m. So please do follow that. The magazine, as we speak, we are working on the June 15th issue of the Seniors Today magazine. So do take a look when we are out with it. Thank you very much again, Dr. Vinod Chavhan. Thank you. And all the best to you, everybody. Please do take care of yourselves. As Dr. Chauhan said, I must just say, every sneeze and every cough is not COVID, but it's important to stay careful, be careful, and whenever possible, do mask up. Thank you.
thank you. Namaste.
Subscribe now and press the bell icon. Never miss an update.